Welcome back. I have a very interesting doctor here today from MemorialCare Saddleback Medical Center. I'd like to welcome Dr. Bill Corey, and he is an emergency medicine at the Advanced Wound Healing and Hyperbaric Medicine Center at Saddleback. And great to have you here today.
Pleasure being here as well.
And you do work in the ER right now. But you also help with the wound healing. And that's really what we're going to talk about today, right?
Yes, absolutely.
Well, welcome.
Yeah.
Great to have you here.
Thank you.
Why is it that some wounds just don't want to heal? What are some of the reasons that this happens?
So there's quite a few different reasons. So that's when a patient first comes to us, we'll evaluate them to figure out that exact question. Why is the wound not healing? Sometimes the wound really needs a cleaning, or we call it a debridement, where the base of the wound is filled with unhealthy tissue. Sometimes somebody has peripheral arterial disease, or PAD, that's really impeding the healing process, and so we'll check somebody's circulation, make sure that it's adequate for healing. And sometimes there are other factors like radiation. Maybe a patient had cancer and has had radiation, and that's really injured the tissue around the area.
Okay.
And it really impedes healing too, and so we do things like advanced therapies, including hyperbaric oxygen therapy, to help those wounds heal.
So with that type of therapy, is it you isolate the person or just the wound when you're doing that oxygen therapy?
So yeah, so the entire body has to go in a chamber. We have 3 chambers, and the chamber is filled with 100% oxygen under pressure. We go to, for those who are diabetal, to 2 atmospheres absolute.
Okay.
And they'll breathe in that oxygen under pressure. It'll improve their tissue oxygenation significantly, usually 10 times or 10-fold.
Wow.
And that'll actually really improve their healing capability, especially if they have that oxygen deficiency, which is what we'll see sometimes.
At what point should somebody come in? And I'm talking about maybe they haven't had some of these other conditions.
All right.
Maybe they got a wound at home somehow.
Sure.
Didn't seem that big a deal. They put a bandage on it, but after a certain length of time, it just doesn't seem like it's healing well.
Yeah, I would say typically if a patient's wound hasn't healed in maybe 2 or 3 weeks, especially if it's a smaller wound that hasn't healed in that period of time, there's something else going on that needs a little bit of help. So I'd recommend seeing a wound care therapist that can take a look and basically do some testing, possibly. Sometimes it'll just need something minor or simple to allow it to heal, but probably a 2 or 3 week time period may be a good guide.
Okay, and it is normal as we age that wounds take longer to heal.
It sure does.
I mean, a little kid, they skin their knee, and 3 days later, you're like, doesn't even look like anything happened.
Absolutely, yeah. So as we age, the healing definitely is delayed, no doubt.
So what type of wounds are you seeing when you do this? Is it simple, like somebody cut themselves at home? Is it due to a major injury?
Yeah, so I would say, a good part of what we see are traumatic wounds, we would call them, where somebody has run into, a dishwasher door or something along those lines. They've developed complications related to that. We have quite a few patients that are on anticoagulants, like Coumadin or Xarelto. And what will happen is they'll develop much more bleeding than would be expected, and the tissue will not survive. We'll have patients with diabetes and have what we call diabetic neuropathy. Their nerves are not healthy, and they have numbness. We'll have wounds related to arterial disease, where their arteries are narrowed and the oxygenation is poor, or venous disease, where their veins are really not able to take blood out of their legs very efficiently, and they develop swelling. And then radiation wounds. We'll have patients who have had radiation for cancers and develop wounds related to that too.
Are they, when you see these wounds, are they large, are they deep, or can be anything?
So it'll run the gamut. So we'll have some patients that have very small wounds that are just not healing over months. And then we'll have some patients that have pretty dramatic large wounds. It could be the size of, an orange, or sometimes even a melon, a small melon, that required quite a bit of work to allow them to heal and really require more longer-term therapy.
And I would think that not getting these taken care of, it can lead to many other problems.
For sure. So whenever the skin is broken, that's our main barrier to prevent infection, and there's a risk for developing a local infection in the tissue. We call that cellulitis. They can get what's called osteomyelitis if it goes down to the bone, or if there's bone exposure. they can become septic, which is
Right.
also obviously very serious
Yeah.
and can be life-threatening. So definitely we try to do everything possible to get that wound closed and healed as soon as possible to reduce the risk of those complications.
So what are some of the things you do to clean out that wound that a normal person at home couldn't do?
Sure, I would say one, we'll do a debridement, it's called typically. So we'll go in there and remove any unhealthy tissue, and that speeds healing and also improves or reduces the risk of infection developing.
Okay.
We'll do that regularly, so typically on a weekly basis. We have a lot of specialized dressings, so a lot of it's basically preventing bacterial buildup or bacteria from building up on the wound and controlling moisture. And then we have advanced therapies we use as well, so things like, we call them skin substitutes or artificial skin grafts that we
Okay.
use on wounds to help accelerate healing, along with the oxygen therapy like we talked about a little bit.
Okay, I asked you before we started here that I've heard that that in some areas or sometimes they actually use maggots
That's
to do
right.
this.
Yeah, absolutely.
And I had heard once it started in England. I don't know if this is true or not, but
Yeah, so
true, false, does it work?
It absolutely works for certain types of wounds, and we've used it for some wounds that have a lot of necrotic, or we call it, dead tissue in the wounds themselves. And the maggots are amazing because they actually eat only dead tissue, not live tissue. So it's like the best surgeon going in there and removing only the devitalized or dead tissue, but leaving the healthy tissue in place. And so they'll start off really small, and over a matter of a few days, they become larger after eating all this dead or necrotic material. This is done in the hospital, of course, and the maggots are caged so they can't escape. But basically, after a few days, we'll have a wound that looks quite, a lot of devitalized or necrotic or dead tissue to a clean, healthy base. So it is quite effective. Not commonly used for practical reasons, but very effective for sure. Yeah.
How do you get them out afterwards? You use a little vacuum or something?
Yeah. So actually, you mechanically remove them. So they're encaged, so they're in a limited space. And when we remove them, we actually we add some solution to them to help express them so that they come out, and we mechanically remove them. Yeah.
Wow.
Yeah.
What should somebody do, just in general, with a wound at home? And let's say it's not a wound that they probably need to come in on.
Right.
What is the proper way to take care of that? I guess it depends whether it's a deep cut or whatever it might be. An abrasion. Should you use the what's it called? The cream that you put on it, oxysporin or something like that.
Oh yeah, like triple antibiotic.
Or that kind of thing.
Neosporin.
Should you just Neosporin? Should you just clean it? Should you?
Yeah. So initially, you want to stop the bleeding, of course. So if it's actively bleeding, we'd want you to put something on it where you're putting pressure on it. Hold that for 5 minutes, then let go and make sure the bleeding is stopped. So that's initially. After that, I would recommend just washing it with simply soap and water.
Okay.
And then rinsing it really well with water.
Okay.
And then from there, it's a good idea to use some type of an antibacterial ointment and then cover it with a dressing. So for instance, using something like Neosporin is fine, bacitracin or triple antibiotic ointment is fine, and then just covering it with a simple dressing.
Okay.
And changing that typically once a day.
Okay.
And usually within a matter of a week or 2 weeks, I would say it should close and heal with new tissue. There should be no drainage. We actually like to prevent a scab from forming. Most people think a scab is a good thing.
Right.
And it's a little bit of not true, actually. We actually prefer a scab not to form because we know that the skin edges will come together faster without a scab, and it'll actually heal better without a scab. So typically what we'd like to do is keep a little bit of moisture on the wound to prevent a scab from forming. Because otherwise, if there's a hardened scab, that can really delay healing. I know, and most people think a scab is a good thing, and they're happy to see it.
Yeah.
And if it's a wound on the surface, it's fine. The wound will heal. But if it's a deeper wound, a hardened scab definitely is not something we'd want to see.
Wow. Now, to do that, are there certain kinds of bandages one should be using at home? And I'm talking about. Again, you got a little cut on your finger, not a big deal. You put on the standard Band-Aid.
Right.
But if something's a little bit bigger.
Yeah, really just keeping it covered. There are different types of dressings, but most things will trap a little bit of moisture underneath the dressing, which will keep a scab from forming. Also adding on an ointment, usually an antibacterial ointment like bacitracin, for instance, will also prevent a scab from hardening so that it comes off fairly easy when the dressing is changed. So, yeah.
And then after a few weeks, if it's not healing, it's time to come and see you folks.
Yeah, and usually what we'll do is we'll typically do some checks, circulation, whatnot, make sure that's okay if it's in the lower extremities, and then try to figure out what's going on. It's a lot of times very readily apparent, like there's too much swelling or the circulation is not very good, and then we deal with those.
Okay, if that's happening and there's no other conditions going on, should someone then call their primary first, or just come in to see you folks?
So they can come in directly to see us if their insurance allows. So some insurances, I should say, they have to go through their primary physician to get a referral. But if they don't require that, then they can come directly to us. We're happy to see them.
All right, where are you folks located?
So we're actually 26137 La Paz Road in Mission Viejo, Suite 120. Okay. And so we're a little ways from the hospital, not too far, but I think
what's the cross street there?
So there's La Paz Road, and it's right off of the freeway. So
right by Cabot there?
Yeah, that's right. Yeah, so it's basically just a block or so from the freeway. It's pretty easy to find. It's in a larger complex.
All right.
So, yeah.
Very good. A lot of great information.
Thank you. Thank you.
Thank you very much. I learned a lot.
Absolutely.
Doctor,
pleasure
hope
meeting.
to see you again.
Absolutely.
You take care.
Thank you.
And we'll be right back, but if you want more information, you can go to memorialcare.org/SB Wound Care. We'll be right back.